Welcome back to the Hampton Road Show. We're still a few weeks away from the start of the new school year. The perfect time to schedule your child's back-to-school dental exam is right now. Joining us now to tell us why it's important are dentists Danny Howell and Brian Geary from Atlantic Dental Care. Welcome back to the Hampton Road Show, guys. And this is a very timely topic that we're talking about because with a couple weeks left, now's the time to schedule that appointment. Why is it so important to get them off to a good start before the school year starts?
It's really important just to make sure that fundamentally their oral health is taken care of. You know, tooth decay is kind of one of the most, it is the most common condition that people are missing school for. Up to 51 million hours of school missed each year for appointments just to check their teeth and have fillings filled.
And Brian, is there this is, you know, the end of the summer, heading into the school year. Is summertime, is that maybe when maybe parents take a little time off or give their kids to the dentist, do you think?
Sure, that happens quite a bit. And, you know, this time of the year, there is a big push to get children in to see the dentist. And it's a really good time to start the year out right.
And I think the first thing that a parent might ask is, how is my child's overall dental health? Is that the first thing you check with a child?
Well, that's among the things that we check. You know, we certainly check for dental decay, but we look at the whole picture. We're looking at the mouth, the external oral conditions. We're looking at what do they need to have an early consultation for braces? Do they need preventative care? Do they need emergent care? All those things that kids need.
And Danny, we're talking about kids going back to school, but let's start at the very beginning. At what age should a child go to the dentist for the first time, and then at what point should it be regular?
Yeah, so the ADA recommends that you have your first visit within 6 months of the first tooth or by age 1. Obviously, those first visits are kind of just more of making sure your child is okay and they're developing teeth and we're not seeing any major problems. And getting your kid comfortable with being at the dentist. It's scary. We have masks on, we have gloves on, we have a lot of noises. So it's really about getting them comfortable. Typically, we want to see kids about twice a year. That's more regular when they're about 3 or 4. But kind of once a year, at least bringing them along on your appointments is a good idea.
And Brian, we talked about getting kids comfortable. You guys are experts at that. You do it all the time. Talk about ways that you can keep kids a little, you know, relaxed and actually make fun at the dentist.
Well, that's part of it. We try to be fun with the kids often and get them to relax. A lot of times we do have techniques and things that we need to do, and sometimes the parents want to help, and they're helpful at times, you know, but sometimes we need to keep control of the situation. But the kids, most kids do great if everybody just goes in there with no expectations and, you know, preconceptions about how the appointment's going to go.
And Danny, what are sealants and why is that important for kids?
Sealants are super important. The most common place to get a cavity, and especially in children, is in those little nooks and crannies of your teeth. So a sealant is basically a small little covering, it's almost plastic, it's a resin, that seals off that area and covers it to make sure that the bacteria can't invade those spaces.
Yeah. And Brian, you always ask, should my child get fluoride?
Fluoride is really great preventative.
Yeah.
It helps actually rebuild the teeth and remineralize is the word we use. The teeth after the beginnings of decay have started, but on a very early scale. And fluoride's a great preventative measure.
And I know, you know, I talked about bribing kids to get into the dentist, you know, how to do something fun, and I mentioned candy. That is just the worst thing. I mean, you guys see it more than anybody. Talk about what candy does to your teeth.
You know, candy is putting that sugar directly on the teeth and leaving it there. Everybody wants candy every once in a while, so it's, you know, it's okay. We're not going to knock it, but you have to make sure you're getting in there and brushing the sugar off, and at least if you can't brush, rinsing with some water so that the saliva can wash away all that sugar from just sitting on the teeth. But things like brushing and fluoride make it so candy's okay.
And which are worse? Are the hard candies or the gummy candies? Which is worse for the teeth, Brian?
I would say generally the hard candies because they sit in there longer.
Yeah. Okay, listen, lots of kids going back to school might be playing sports. How important is that mouth guard?
Super important.
Very important. Anybody that's in a contact sport definitely needs a mouth guard. And on top of that, if they have a mouth guard, they ought to bring it with them to the dental appointments we can check and make sure it fits. You know, kids change, just like they have to change their clothes, they have to, the mouth guards need adjustments and that sort of thing. Plus, we can usually clean them.
Oh, good.
Which kids
Yeah.
don't do so well
No,
sometimes.
no, they don't, and we understand that. But listen, great advice, Danny.
Yes.
Brian, thank you so much. Once
Yeah.
again,
Thank you.
Atlantic Dental Care with 74 locations serving the entire Hampton Roads area. Dr. Howell is at Atlantic Dental Care on Western Avenue in Suffolk, and Dr. Geary is at the Atlantic Dental Care on Terrebonne Road in Grafton. The phone numbers are right there on your screen. You can also visit atlanticdentalcare.net for more information and to make an appointment for those back-to-school checkups. Thank you guys for joining us.
Thank you.
you.